Hello everybody, my name is Dr. Mike Blaney, General and Bariatric Surgeon at Live Healthy MD in Augusta, Georgia. Today in our video series we're going to talk about the laparoscopic gastric band. Should I or should I not have this operation performed? This is a really common question that I get from my patients all the time. Lap band is still considered in 2019 a acceptable bariatric procedure to be performed on our patients. However, in my experience over the last 20 years of doing these operations, laparoscopic gastric band unfortunately has had a variety of disappointing outcomes. So in our practice, it is not a procedure that we routinely recommend for our patients. I think there's a small group of individuals that I might still consider the operation a reasonable procedure, but in my professional opinion, it's certainly not our first choice of operations for the vast majority of our patients. The appeal to the lap band, when it first made its debut in the 1990s and became routinely performed in the United States in the early 2000 period, was that it was a simple, safe, reversible operation that did not alter any of the body's anatomy, as the gastric bypass, the sleeve, and the duodenal switch do. And all of that is true. So we noticed as surgeons a lot of individuals coming to us asking for these procedures to be done, and many of thousands, hundreds of thousands of these procedures were performed over the early 2000 time frame. Unfortunately, as patients got further down the road after these operations, we began to notice a variety of disappointing outcomes, such as poor weight loss or other potential complications such as band slippage and band erosion that occurred many years down the road. Oftentimes patients were just dissatisfied because of the dysfunctional eating behaviors that they would have, such as the feeling that food was getting stuck or throwing up. So this is a model of the lap band. It's a device that goes around the upper stomach. And it has a balloon that's in contact with the stomach connected to this tubing, and this tubing goes to a port that's under the skin on the abdominal wall. In the office, over a series of months, we will inject water into the port that will then fill the balloon to make the balloon tighter around the upper stomach. The whole idea is that an individual will eat and food will fill the upper part of the stomach, giving a sense of early satiety and fullness. Unfortunately, not many patients had what I would consider to be a happy zone or a green zone, a zone in which they would eat small meals, feel satisfied, and have satisfactory weight loss. Many times patients would have the feeling that food was getting stuck. They were feeling like it was too tight, or the band was too loose. As a result, I'd have my patients coming back after these operations requesting the band to be removed or converted to more effective weight loss procedures. As we'll discuss in other videos, we believe a significant component to an individual's weight loss after these surgeries is changes in hormones that regulate our metabolism. So we refer to bariatric surgery as metabolic surgery, surgery that changes our metabolism. And this occurs as a result of diverting food away from the first part of the intestine, known as the duodenum. And this occurs in the operations such as the gastric bypass and the duodenal switch. Fortunately, with the lap band, none of these metabolic benefits that alter our metabolism occur. So in our professional opinion, I think this explains why the gastric band really just resulted in disappointing long-term weight loss results. Thank you for watching, and don't forget to subscribe. If you like this video, please give us a thumbs up.